Hey, welcome back. My name is Dr. Delon Canterbury, CEO and founder of GeriatRx. I hope you guys are doing well. Welcome back to another episode of Red Pill versus Blue Pill, where we talk about unleashing your potential to become a deprescribing advocate and learn some of the best tips and tricks I have used for your senior care practice. So today we will focus more on some of the 5 best practices that caregiver advocates and senior care providers and clinicians alike can use to literally start deprescribing in their setting today. So of course, this is one of my passion projects and favorite things to talk about in the senior care space. But honestly, the first step that you need to start taking is to change your medication mindset. What does that mean? What exactly is that? What is your philosophy around medications? I can't lie. We've been a little brainwashed in our system here to assume that medications are indefinite and permanent, and you just have to be on them for the rest of your life. But the truth is, we're going to take that red pill today and show you what life is after following Neo and Trinity and myself as Morpheus to show you that there is a world outside of assuming every single person needs to be on a medication, especially in our most vulnerable population. So the first choice you have to make as a senior care provider is to decide, do you want to be a deprescribing advocate or not? Do you want to pass the buck and let another patient potentially put themselves in harm's way? Or do you want to actually change the way you may do business and operate to integrate pharmacists and geriatricians into a more clinically medication focused approach? That's the question I have for you today. So, what step do you want to take to start openly talking about the lack of medications or the need of medications for your senior patients? The truth is, it starts with a mindset shift, but it also helps to have some type of guideline. And so today, I'll be sharing with you some of my best favorite tips and practices that you can put into practice right now. So, first and foremost, I have to ask, when you see patients that may be over medicated or suffering from side effects in your clinic, what do you think to do first? What's one of your first instincts on how to address this? What's your gut feeling telling you? And when patients kind of hit this scenario, they're not sure how to best approach this. In fact, when I speak to caregiver providers and senior care clinicians as well, they're not always sure the best steps. Of course, the easy and automatic approach is, let's tell the doctor, let's let them know. And of course, instinctively, it's not a bad idea, but it doesn't always address the entire problem. And unfortunately, it puts the onus back on the patient or caregiver and leaves it to them to bring up at their next clinic or visit. And so, as nice as we want that to be the easy and quick fix, you and I both know that our providers are inundated with tons of tasks to accomplish, and our patients and caregivers have what we call life to deal with. And so that may not be on the top of their priority list. But you, as a senior care clinician or as a provider, can leverage and integrate some of your pharmacist staff or work with independent consultant pharmacists like myself who can show you some of the tips and build a toolkit and guideline to help better improve your patient's life and well-being. Like, who doesn't want that, right? So if your goal is to actively choose how to improve and increase your patient satisfaction, then the red pill is definitely the right choice for you. If you are willing to integrate systems in place or to contract out work with maybe another pharmacist or repurposing some current staff that you may have, we got to start looking at some of the risks and some of the benefits of some of the medications that your clients are on. Are you willing to take that step? Is that important to you? Is this urgent for you? Because again, we all want to make sure our patients' livelihoods are at the top of our care, but we also have to survive. We have businesses. So how can we make this type of service into a revenue generating stream for you as well and your practice? One of the easiest questions after you start changing your medication mindset and seeing them as a way to be on the least amount as possible, you want to first ask, how many meds are your patients taking? I mean, this is a simple one. Hopefully, they're not taking 36 like my first patient, but is someone who's coming to your clinic, and you could be a therapist, you could be just coming in for an annual. Let's just talk. Are they on more than 5? Are they on 10? Are they on 20? 15? Like what's the number, right? And this is the first and easiest step that a clinician can use or a patient can use when it comes to their loved one's well-being and their medication regimen. So that's the first one to ask. Are you on more than 5? If you're seeing 7, 8, 10, anything more than 5 statistically has been proven to potentially lead to less adherence when it comes to that medication regimen. So that is shown to be an increased risk of the beautiful word we call polypharmacy. So polypharmacy is the use of more than 5 medications. It's loosely defined. It could be 5, 10, depends on where you are, but most people use it as 5, more than 5, where there's also an issue where different patients may see different providers and specialists, and there isn't cross communication between what's prescribed and what's hitting the pharmacy counter or what the patient's actually really taking. And so when you have this broken part here, broken part there, there's a lack of consistency and transparency in that medication regimen. When this occurs, there's increased risk of harm for the patient, unfortunately. Especially when our older patients, they're more susceptible to having increased readmission rates, hospitalization rates, harm, reduced quality of life, comorbidities, and of course, increased mortality as that number of meds that they're on continues to increase. And it's even more risky for our patients who are older and have chronic conditions like diabetes, high blood pressure, etc. And so the more chronic conditions can almost equate at times to more medications. So there are techniques that you can start using to address both polypharmacy and, of course, the chronic conditions that our seniors may have. So number one, we talked about easily medications, how many are they on, how many are they taking, is it more than 5? Whatever that is, that should be enough to spark a dialogue and conversation with your senior patient and try to get to the nitty gritty of, do they really need all those meds? Is there an indication and use for each one of them? Is it really still effective? Is it appropriate? Is it necessary to still be on that med while he's 90 years old and controlled on everything else? Like, is it need to be on insulin still? I don't know. But that's a question that your pharmacist can answer. But this is also something that we will teach you how to learn how to address when you see this in real time. So after you make this concise and amazing decision to not only choose the red pill, but start talking about deprescribing actively, we have to give you the tools to help you put this into your clinical setting so it becomes easier to follow and reproduce and, of course, maintain sustainability. That's also what we will show as a part of our Deprescribing Accelerator group. So what really helps is to have a step-by-step toolkit to help you lead this conversation and help you integrate these methods into your current practice. They want to have a system, right? Who doesn't want a system? You want something that's easy. Okay, more than 5. Okay, boom. Here are all the meds. All right, great. Are they still appropriate, necessary, effective? Again, a pharmacist is something that can specialize in this wonderfully. So keep that in mind when you're looking to grow revenue for your senior care site. However, you could still leverage some of your own staff that may be clinicians or nurses to look at this and have the lens of a deprescribing advocate, which we will show you exactly how. And then, of course, another way you can take this step to actively start deprescribing is to make sure you are having BFFs with your local community pharmacist. It could be a consultant pharmacist. It could be, a concierge pharmacist, community. It doesn't really matter. You just want someone on your team who can do this part and make life a little bit easier for you, but also to actively teach and integrate this mentality, this mindset shift, this medication mindset, to be rampant upon your practice. It shouldn't just fall on a clinician. This is why I stress over and over that administrators can be advocates for deprescribing. Patients can be advocates for deprescribing. Caregivers, especially, are advocates for deprescribing. So there has to be some cognitive changes that start within you and your business setting. So, of course, medication mindset is first. Secondly, is what is your attitude about reducing meds? Do you think this is a their problem or a you problem? Are you seeing that them being unmanaged with their care can inadvertently lead to you wasting your time and money and resources to help manage their health conditions? That could eventually help you lose money in the back end or get dinged for Medicare audits whenever they come on board. Another patient or another approach that needs to be talked about is what is the buy-in? What is the assessment? What is the patient's shared decision in this thought process about deprescribing? It's not going to happen unless the patient wants it to happen. It's just, you got to make sure you're educating and giving them an objective perspective on how they can get off of their meds if need be. And so the patient buy-in is critical. Even though you may have all the deprescribing power and tools in the world, if you don't have a patient who really wants to rock the boat or doesn't see a need for it, then you have to address that in the moment as well. And that's where your local clinician can help, or your pharmacist. But also, this is what we will teach you how to talk through when it comes to our deprescribing accelerator. Another thing is to simply open the door and have an open line of communication with your team about why this matters, and talk more about the benefits of how you're able to improve quality outcomes. If you were to establish some type of deprescribing regimen through your senior care practice, it's going to get word that you are providing a valuable service to other local clinics. And so that could potentially lead to another revenue stream for you with referral basis, with increased growth, with improved customer satisfaction, because you are putting in the tools in place to make their lives easy. And the less meds, the better for clinicians and for the patients. Am I right? So one thing that we can also see and use to really get you thinking about your medication mindset is to question everything when it comes to these drugs, okay? Question everything. I don't care if they just started it. I don't care if they've been on it for 20 years, 15 years. Talk to your patients about their comfortability with how they're using their meds. Talk to them about their willingness to take their meds. Try to get to the bottom line. And guess what? They will tell you more stuff than they will normally tell their providers. They will lay it all out, okay? They'll talk about why they don't take this. They'll talk about why they may double up this time because they don't want to take it at night. They may have bathroom issues. I mean, the list goes on and on, right? So talk to them about why they may be on certain meds. And if they don't know, they don't know. But document that and see if there's truly a need. And if you find some issues in their care and their meds, then that's a way that you can, again, leverage your pharmacist and develop that streamlined communication between the provider and, of course, the patient's family. Another tip, this is the fourth one, that is going to be critical for you to start actively thinking about deprescribing in our seniors is, are you using the Beers list? Literally the Bible of potentially inappropriate medications in our seniors. Now, it's not a hard and fast, every drug on this list. That means it's a red flag, it's a no-no. But it is something that you can have readily handy in your clinic, in your office, in your outpatient setting, wherever you are, and make this an ongoing discussion with your team. Just talk through the Beers list. And I can't tell you how many medications, and this is one of the most cited documents when it comes to seniors and inappropriate meds across the entire world. And so I can't tell you how many patients I've seen who have something or another, or a combo of multiple drugs, who are on this list. And that's what gets my red flags up. Of course, any pharmacist can learn this, but it doesn't hurt to have your team be aware and maybe have a poster in your office or a sign that says, hey, if you're diabetic, some of these drugs right here, may not be longer appropriate, right? We're not here to play doctor, okay? We're here to play as a healthcare team. So I'm not telling people to become mini pharmacists or telling people what to do. I'm telling people that the more people who have touch points with patients to advocate for deprescribing, the better the streamlined care there is, and the more likelihood you can have more impact when it comes to reducing unnecessary harm. That is why this is so meaningful to me. And in my work of working with patients, going to nursing homes, giving presentations, talking about caregiver conferences and how they can advocate for this, the questions and answers are still the same. And it's generally, I don't understand why they've been on so many meds for so long. And no one wants to rock the boat. No one wants to stand up and say, hey, this is a little off. Let's actually do something about it, okay? Let's actually put something into practice and not pass the buck like we tend to often do. So getting real comfy with the beers list is easy. It's free. There are tons of things you could download right now and just print that bad boy, make a poster, put it in your office, put it on your wall, and then start talking about what's on it with your team. It's not that hard. Just talk about what's on it and then start looking for the reasons why. They literally tell you that there's an age contraindication. It tells you if there is maybe a kidney indication where it's like not the best if you get poor kidney or liver function. And this has been going on for decades. The American Geriatric Society literally made this Bible, so to speak, for potentially inappropriate medications. So if you're not using it, then how are you going to really know what's going to be a potential red flag for you? And this is something I use for all my cases, is to at least cross-check if the medications are on the beers list. Okay, so the beers list is great. It's free. They have shorthand versions that you can have readily on your desk. So if you're a therapist or if you have someone who's a first-time patient, start leveraging your pharmacist and start using your clinical team to actively think about what are all the health conditions this patient has in front of me? What are all the meds that they are on, and do they match up to all the health conditions that they have? What's their quality of life? What's their socioeconomic status? Can they actually afford to even take all these medications, right? Are they having issues getting the care that they need? Are they at goal with their diabetes measures or their sugars or their blood pressure or whatever right? If they don't even have a good quality of life and they're on a ton of meds, then there's something wrong. There's something wrong in that patient's holistic and comprehensive care. So we talked about the beers list. The last thing, of course, is one of my favorites. It's pretty easy. Make pharmacists your BFFs. Hello. We do not integrate pharmacists enough in our healthcare setting. And so it doesn't have to be straight retail, straight hospital for pharmacist tracks. They can literally integrate anywhere, okay? And I'm telling you, I'm doing that, especially when it comes to these nursing homes, these adult daycare centers, these caregiver support groups. All of them can leverage a pharmacist and use their expertise. So I'm asking you, as a business owner, as a senior care provider, is there a pharmacist on your team that can do most of this stuff at ease? Or are you willing to repurpose people on your team who have at least some clinical experience to be able to speak to this matter? So use them, leverage them. We are amazing at this. And so this is not just a passion project, guys. We are literally unveiling how you can start using deprescribing today. Again, it starts with you. Are you going to change that medication mindset? Are you going to start talking about if you're on more than a couple of 5 meds and you're not seeing them being, well managed? Are you going to have that conversation, or are you going to let it just go? All right. Are you going to be able to be an advocate, a deprescribing advocate, willing to question everything when it comes to your patient's medication regimen? 4, are you going to learn that beers list? Learn it, have it nearby, do a quick Google search. You can literally just do Control F if you're talking to a patient. and see if it's on the beers list. And that could be something that can tell you why there may be harm or potential risk with that certain medication. And lastly, of course, number 5, make pharmacists your BFFs. Okay, we can make life so much easier when it comes to deprescribing. So we are here to show you the way. And again, this was a fantastic episode with Red Pill versus Blue Pill with Dr. DeLon Canterbury. I hope you guys found this helpful. Put this stuff into practice now. It's not too late. You could start experimenting with this. Start putting this as a part of your clinical intake forms. Make this a part of normal conversations. Ask your team if they're aware of the beers list. Like, let's get started, right? Let's get started with some of the basics right here. But again, you can use all of this right now, okay? Get familiar, learn the tips and tricks. I hope today was helpful. We talked about the 5 best practices that caregiver advocates and senior care providers can use to start putting deprescribing into place. This is Dr. DeLon Canterbury, again, CEO and founder of GeriatRx. If you want to join our accelerator, there is an application process, but make sure you comment below, comment Red Pill in the comments, and I will directly reach out to you and see if this program will be best for you and your site. You guys have an amazing day. Take it easy and all the best. See you till next time, all right? Take care.